Do you have nagging knee pain when you try and play golf or other sports and you're trying to figure out whether or not wearing a brace would be of some benefit to you? Well, stick around because I'm going to answer all those questions for you. I'm Dr. Brad Homan, board certified orthopedic surgeon in Orlando, Florida, and I specialize in sports medicine, and I have treated in my over 20 years thousands of painful knees. And so I've got some advice as far as if a brace would be helpful for you and what kind of brace would actually be the best. So I'm going to start with a little anatomy. So using my little model here, this is very basic knee. So you've got your femur up on the top, tibia on the bottom, kneecap is in the middle there. As you're bending and straightening your knee, your kneecap is going to be gliding up and down into this little groove here. And so one of the issues that you might be experiencing as you're bending down and squatting and standing back up is potentially feeling pain or having some noises from your kneecap going back and forth. Also, all the way around your knee, you've got what's called ligaments. These are basically tissues that hold the bones together, and they keep your knee from going too far one way or the other, and they also help limit rotational forces. So those can also be put under a lot of stress during a golf swing, especially in that lead knee, because you're loading that knee a lot and there is some twisting going on. And over time, those ligaments can start to take that strain and they can become inflamed and cause some pain. Inside the knee, this is just a very basic view of the inside of the knee. You've got some ligaments in the middle called the anterior cruciate ligament and posterior cruciate ligament, which are also responsible for stability. And then you've got these little rubbery cushions that we call the meniscus. And the meniscus are little shock absorbers inside the knee joint. But if they become damaged or if they get a little bit older, then they can also cause some symptoms in the knee. So that's the basic anatomy of the knee. And so as you're playing sports, sometimes different kinds of sports, different kinds of motions can aggravate some of these structures, the ligaments, also the tendons, the muscles, and things of that nature. If you get arthritis in your knee as you get older, that means that the cartilage starts to wear out. And not only does that cause catching and popping and locking, but it can also cause swelling. Arthritis and different tendinitis problems cause inflammation. That's what the words itis means, is inflammation. And so that's not only painful, but that can also cause symptoms. And so generally, instead of going to a brace, the first steps are going to be strengthening, because your muscles are what supports your joints primarily. So the ligaments I mentioned hold the joints together. They hold the bones together, but your muscles wrap around all of your joints. And so if you're feeling like your knees are unstable or your knees are weak, then the first step is always to be involved in a low impact fitness strengthening program, because if your muscles are tight, they're actually going to give you the support that you need. Now, if you're doing that already and you're still having some issues, then that's where a brace might be of some benefit to you. And so the more mild the issue in general, the less of the brace that you're going to need, and the more significant the problem, then the more support that you're going to require. So I've got examples of some different braces that can be very helpful, starting with the simple knee sleeve, which is this one. So basically, this is just a wraparound kind of support that gives a little bit of compression, and it is thick enough to give a little bit of support if you're not really having instability problems and you just need that little bit of comfort. This particular brace, this one is made of neoprene, which is a very thick kind of rubbery material. The only issue with a sleeve that's neoprene, especially in hot weather, is that it can cause sweating and it can get a little bit nasty underneath. So some patients prefer to use something just like this, but in a cloth form. There are very thick elastic cloth braces which have the same effect, but can be a lot more comfortable in hotter weather. So if you've got a little bit of swelling in your knee, a little bit of achy pain, and you're not really unstable, then this is a good basic startup brace. And because it doesn't have a whole lot of other supports and it's not very bulky or cumbersome, it's not going to affect the game that much. If your knee pain is primarily in the front of your knee, or if you feel like it's your kneecap that's the problem, then a knee sleeve that actually has an open hole for the kneecap is a good option. This extra hole right here sort of captures that kneecap and gives it a little bit of support. And a lot of these braces will have extra material around that hole, and it really sort of grabs that kneecap and keeps it from moving around too much. Because the best place for the kneecap is right in the middle of your knee. You want it to just move up and down as your knee bends. You don't want it to be going side to side or tilting one way or the other. And again, if you're having those symptoms, the most important thing that you can do going forward is strengthening exercise to stabilize that knee. All of your muscles, or your quadricep muscles and a lot of the other muscles, will actually attach to your kneecap. And so if your muscles are tight, there's going to be inherently less movement in that kneecap. And so the basic treatment long term for kneecap pain with activity is keep the muscles strong to support that joint and tighten it up a little bit so the kneecap isn't moving around quite as much. So we move on to the next kind of issue with the knee would be instability episodes. So if you're having the discomfort, if you're having the swelling, but you also feel like your knee is unstable, that can either be because your ligaments are a little bit weak, that potentially could be arthritis making your knee feel unstable, and in some cases the meniscus that we showed earlier can have tears, and that can cause instability as well. And so if you're feeling instability in your knee, then a better option would be a brace like this that's not only the neoprene brace, so it's got the compression and the support, it also has hinges on the sides, and these hinges provide extra stability if your knee is giving way. So again, it's not very bulky and cumbersome. These are form-fitting, but if you're having instability episodes, then a brace like this with hinges on the side can be extremely effective. The other issue, if you happen to have arthritis, and that arthritis is bad enough that it's actually causing a deformity in your knee, we would call this knock-kneed or bow-leggedness. So if you see that your leg's actually changing and it's not straight anymore because of the significance of the arthritis that you have or the severity of that, then a brace with hinges on the side can help straighten your knee out. And usually if you happen to have that kind of deformity, most of your weight is put on the bad side of your knee. And so if you straighten your knee out with one of these, then that also will shift your weight to the better side of the knee. And that's another way to reduce the swelling and the pain and the clicking and all the other symptoms that you're getting. The largest, more bulky, but also effective brace for deformity if you have arthritis is something like this. So this brace is what we call an osteoarthritis unloader brace or an offloader brace. So again, if you've got deformity, not only is this straightening up your knee like a hinge knee brace, but it's literally pushing your leg slightly to make it more straight. So if your deformity is significant and the hinge knee brace in and of itself is not quite supportive enough, then something like this is your answer to push your leg a little bit straighter and shift your weight from the bad side of your knee to the good side of your knee. So all of these braces are made for sports. They're meant to be as low profile as possible, but still provide the support that you need. As I mentioned before, it's not a substitute for a fitness program, so that's extremely important. If you're not doing a strengthening program for your legs outside of golf, that's the number one thing that you should be doing. The more severe your problem is, the more substantial the brace should be. And the other thing I would tell you is that braces aren't for everybody. So even if you follow these tips, some people just don't like to wear braces. And so even if you have a brace that was prescribed to you or it should be good for the condition that you have, a lot of times it's too cumbersome. People don't like the feel of those. And if that's the case and it's not helping you, then don't wear the brace. So that's my advice as far as bracing and the different styles of braces for the different conditions that you have. Also have 5 tips to get rid of knee pain. Go to golfkneepainnomore.com and you can get that. It's a little bonus content. If you like this video, please like and subscribe and keep an eye out for further videos going forward. I'm Dr. Brad Homan, orthopedic sports medicine specialist in Orlando, Florida, and keep yourself strong, keep your knees strong, and be healthy.